If you're ready to feel like your best self, you have some room for improvement in your health, or you're looking to explore the infinite possibilities within wellness, then welcome to the Empire Wellness Podcast. Listen in to your host and renowned wellness expert, Charlene Lawrence, as she shows you how to build your internal and external wellness empire. Charlene is a licensed acupuncturist, certified hypnotherapist, and master of traditional Chinese medicine. She'll introduce you to the solutions that have yet to be on your radar. Now here's your host, Charlene Lawrence.
Welcome back to the Empire Wellness Podcast. Today's guest is Dr. Ben Miraglia, who graduated from SUNY at Buffalo School of Dental Medicine in 1993. He has over 30 years of general practice experience in Mount Kisco, New York, including over 20 years of orthodontic experience, where his focus has been on early childhood jaw growth and development. Dr. Miraglia lectures nationally on early childhood malocclusion, its connection to sleep-disordered breathing, and early treatment options. Dr. Miraglia could bring a different dimension to your discussions, exploring topics like the role of oral health and learning efficacy and its deep connection to overall well-being. His experience in early childhood jaw growth and combating sleep-disordered breathing might offer your listeners new insights to ponder. Dr. Miraglia is the VP of GP Clinical Education at CandidPro. He is the Chief Clinical Officer at Airway Health Solutions. He is on the Board of Directors of the American Academy of Physiological Medicine and Dentistry, and he is a founding member and Chief Clinical Officer at Toothpillow. Dr. Miraglia also has an excellent way to receive a complimentary evaluation from a highly trained airway dentist and $250 off your treatment when you book between now and January 31st of 2025. Don't worry, if you're listening to this outside of those dates, you can still receive 50% off the consultation and $100 off treatment. Just be sure to mention Empire Wellness in the referral section when booking. All right, this was such a fun and enlightening conversation that I got to have with Dr. Miraglia. I cannot wait for you to listen. Let's dive right in. I am so excited for today's conversation.
Yeah, thank you for having me. I'm excited. It's my favorite thing to talk about, and I'm looking forward to having a little bit of fun.
Awesome. All right, so I am going to just dive in. I am curious what wellness means to you.
Yeah, so that is a big one, but it really spans everything. It's not just the nutrition, it's not just the sleep, it's not just the exercise, it's not just the spending some time in the sun outside. It really is all of it. And so, from the moment you wake up to the moment you go to sleep, you have a daytime routine that should be rooted in wellness. And it really involves everything you do for the entire day. But then when you lay down to go to bed, there is a wellness routine that needs to be taken care of overnight. And so, wellness is really 24/7, 365, making good choices so that you could really achieve and maintain optimal health for yourself and your family. And it seems like there are a lot of opportunities to make bad choices. And so I would say wellness is, making good choices all day and night, as well as avoiding the bad choices, which isn't easy to do.
Right. Yes. Avoiding those bad choices is definitely hard, but I'm glad you touched on, I think you're the first person who's ever brought this up, those nighttime wellness routines. And I know we're going to get into something that's very exciting and actually kind of a newer concept for me. So I'm really excited to kind of talk about that nighttime wellness routine, because when we're unconscious and passed out and sleeping, it's like, well, how can we impact that? And I know that we're going to talk about that today. But before we dive into all of kind of the how-tos, I want to know what your wellness story is. So just go ahead and kind of start at the beginning. And how did you get into dentistry? How did you get into wellness in general, but especially this nighttime version of the wellness routine?
Yes. So, yeah, a very long time ago, like ancient history, 31 years ago, I graduated from dental school. I went to dental school because I wanted to be a dentist and I wanted to, fix teeth. Because at the time, you're thinking you're fixing teeth is what a dentist does. And then you are going to help people because it's nice to have, healthy teeth, nice teeth, good looking teeth. All these things wrap into what at the time I would call wellness.
Mhm.
Okay. Well, fast forward about 10 years of fixing teeth. And I started to take some courses on early intervention. And it was specific. Kids being treated earlier have a different opportunity than waiting the traditional route of getting braces when you're 12. So
Mhm.
this was my pathway where my first pivot was I'm watching kids get braces from 12 to 14. I'm looking at this and I'm seeing, okay, I get it. The braces force the teeth straight. But the funny thing is when the braces come off and then you stop wearing your retainer, they go right back. Like, well, that's not very successful. Then you see part of the routine is maybe extracting some teeth. Well, taking teeth out, that always seemed horrific. And I didn't know I didn't know a lot of stuff back then, but I knew that felt bad. Like, ooh, taking out teeth, it's a good tooth. It doesn't have any cavities. Like, what's wrong? It doesn't fit. Well, you start to learn a little more. And it turns out you learn that teeth are a symptom. And the cause is the underdeveloped jaw, the structure of our foundation there, the maxilla, the mandible, the upper and lower jaw, they're too small. And when they're too small, your teeth don't fit. So addressing the teeth late became, oh, we're treating the symptom, but that you could do that forever, over and over and over. Why don't we treat the cause instead of the symptom? The coursework, and this dates back about 20 years ago, I started in this direction. I started learning about, early intervention meant growing the jaws. If you grow the jaws earlier, then you get the teeth coming in where they belong. Less crowding, less to do with the braces, and an easier transition later on. So became foundation first, teeth second. So I start to graduate from tooth focused to foundation focused. Now, the big light bulb went off a few years into this because at first I was growing the jaws early to help the teeth fit in. And basically, it became a non extraction technique. I didn't want to take teeth out. So I knew if I could grow the jaws, all the teeth fit. Well, all of a sudden, you start seeing children improve and just hearing from a parent about little things that you're not really paying attention to, but you're learning along the way. One by one, you start to learn that bedwetting is fading away.
Mhm.
Kids don't get ear infections anymore. We're not having nightmares anymore. We're sleeping through the night where we weren't before. We're not as restless overnight. My child's snoring, but now they're not. And so just these little things, I'm focused on foundation, teeth, blah, blah, blah. But then a decade goes by, and in spending a decade and you're hearing responses and you're learning about these kids, you start seeing other lecturers and other coursework and recognizing that, the breathing is totally related to the jaw size. And so it turns out you get more pieces of your puzzle along the way, and then you start learning about myofunctional therapy and doing the myofunctional therapy for the head and neck to work through breathing, musculature, and posture for better growth and development. And then you start putting all the connections together because you're getting these pieces. So over a decade, I collected these pieces. And my pathway from tooth focused to foundation focused is my wellness journey. And it turns out the growth of the jaws really does dictate how well you breathe. And so a human being is an obligate nose breather. It is the only pathway to health is being a nose breather 24/7, 365. Mouth breathing is wildly unhealthy, and it does set in motion a kind of domino effect of having symptoms downstream from mouth breathing day or night.
Mhm.
And then you start to grow the jaws early, you get your breathing back, you get your sleeping back, you become healthy, your symptoms go away. So my pathway was from the teeth to the jaws to the breathing to the healing. And what we now know, of course, I'm 2 decades into this, grow the jaws early, give that child back nasal breathing day and night, and they will not only sleep better, but they will totally heal. And we see children have full symptom resolution, as well as children who were recommended medications for certain symptoms that exist
Mhm.
don't need them when the symptoms disappear. Children that we meet who are already taking medications, when the symptoms fade away, can remove the medications. And so we've helped a lot of children in the medication department where they're having symptoms, but there's the academic department where we've seen incredible changes where that student who is struggling with extra help, tutors, maybe even an IEP, the
Mhm.
individual educational plans that are in place,
Mhm.
all of a sudden with better breathing, better sleeping and healing, they can focus more at school and have better ability to not only receive the information, but then process it overnight. And sure enough, that student can grow out of their IEP through the jaw growth and development, of course, and become a straight A student without extra help, and then go on to a better college and better career. So the wonderful pathway for me has been a slow and steady. I didn't have all the puzzle pieces at first. I certainly made my share of mistakes early on, but I did graduate from teeth to foundation and growth and development focused. And I recognize that true wellness really comes from oral health as a big component of our overall health is our oral health, but we need the jaw growth and development, not just teeth without cavities.
Oh my gosh. You talked about that so succinctly, and I'm so excited, and there's so many great nuggets, and I have a ton of questions. So we'll see if I can bring them all to the forefront. I was first introduced to this concept really just a couple years ago, maybe hearing another podcast, kind of like a biohacking podcast, where they were talking about nasal breathing and mouth taping at night and those types of things. And I finally had the opportunity just a few months ago I listened to the book Breath by James Nestor. I'm sure you're familiar.
Yes.
And he goes into such great detail about exactly what you're describing. And so my big question really is, for those of us who aren't young and had the traditional dental journey like I did. I got the braces at 12. I had the wisdom teeth extracted at 17. And I had to have a couple of teeth pulled while I had braces to make room. Didn't know I was supposed to wear my retainer forever. So then a few years back, I did the Invisalign thing, and now I wear a retainer to bed every night. But for those of us who had that similar journey, basically, and I'm not 7 years old anymore, is there anything we can do to still improve our jawline, to improve our nasal breathing, and maybe alleviate some of these symptoms? And if so, what are those things we can do?
Yes. So adults still have opportunities, and they're just a little different. And like you mentioned, a child has immature bone. It's softer. Children's bones are like a wet sponge. So you can really mold them and get them growing again. Adults, it's more mature. So the bone is that dried up, harder sponge. But meanwhile, the adult has opportunities. And the number one opportunity would really be visiting a myofunctional therapist. Because as an adult who had crowded teeth with braces, then you had aligners, you have the history of having the crowding and the bad bite. Well, we got it for a reason. The reason we got it was really the muscular dysfunction. So when the muscles are dysfunctional, that's when the jaws don't grow well. And then we get the crowded teeth and bad bites. So addressing the teeth like you and I had, braces, then aligners to fix what we throw a retainer out, all that stories are very common. But when we've done all that, yes, we have now the straight teeth, and I can wear my retainer to bed just like you, that clear retainer to hold it. Or you could start to address the underlying cause, which was the muscle dysfunction. So just because we got braces as a teenager and we wore aligners, it doesn't mean our muscles are properly functioning. So the adult should, number one, start with a myofunctional therapist. And that means you find one locally, you do a little Google search, orofacial myofunctional therapy near me. If you have one local, terrific. If you don't, you start reaching out to the ones who are further, because a lot of them can do it via Zoom. You can get on a Zoom, and basically you're mimicking exercises of the jaw muscles, which are all inside. It's basically head and neck physical therapy. So many people have never heard of the words orofacial myofunctional therapy. It's a rapidly growing profession. It's a wonderful service for any age human being. And I did not know it existed 20 years ago. And then, of course, when I found it, you realize, oh my goodness, I've been missing this whole piece of the puzzle. So now I know an adult would start there. You find a good myofunctional therapist. Now, they're going to do evaluations, of course, and then begin a treatment process. Because if you can correct the muscle dysfunction, retrain the musculature to behave properly, you get your breathing improved, you get better muscle function, you can improve your breathing and sleeping that way. They might also uncover what we would loosely say tongue tie or lip tie or cheek tie, because those are out there. We have these frenum in there and they're attachments, but when the tongue is too restricted, we call it a tongue tie. When the lip is too restricted, we call it a lip tie. And if the cheek might be too restricted, it'll be a cheek tie. Well, these are things they would evaluate and learn, because an adult could have those released with simple techniques today and then the myofunctional therapy to train the muscle how to do it. It's almost like your muscles are bound and not allowed to do their full motion and full exercise. And so then we're heading in the right direction. So that's one category, myofunctional therapy. Nasal hygiene. An adult could really take this on at home and do it themselves. You can blow your nose several times a day. You can use natural nasal sprays, because I'm not a fan of the ingredients that we all know are out there that are not really to be taken every day routinely. So natural type of simple saline, things that are natural. You can use those sprays, and keeping your nose clean is wonderful. An adult could try something like a breathe right strip at night to bed. Applying a breathe right strip, maybe flare the nostril a little bit with the breathe right strip. It could improve airflow. You might notice a difference. So in the nasal hygiene category, there's a number of products out there. You can certainly try stuff, and I recommend the natural products, but doing the breathe right strips can help. Now we've got one other category coming, which is, okay, what about the, let's say, orthodontic work as an adult? So it turns out that there are expansive techniques that can help an adult. And we may not get the same growth in the bone that kids get, because they're younger and they're, basically that immature bone is more susceptible to catching up in the growth. But an adult can have non-surgical techniques as opportunities, as well as surgical techniques. So some of it does depend on symptoms. Now, if you're an adult and you recognize that, my teeth are crowded, or I have a bad bite, and I've had braces a couple of times and even aligners, but I know I don't sleep so well, and maybe I do snore a little bit, and you don't know what you really have, having a sleep test isn't bad. Having a sleep study is not bad as an adult, because you kind of want to know, like, how bad is my breathing at night? If you do have obstructive sleep apnea, that's a whole nother level of unhealthy, where you might want to pursue that CPAP machine to get stabilized, and then pursue opportunities, whether they're non-surgical expansion techniques or surgical expansion techniques, because you're going to need more room. And it all comes down to, if the jaws are too small and we have crowded teeth that were corrected by braces or aligners, when the jaws are too small, it does make a difference on the inside. The air is supposed to come in our nostril, and right behind the nose we see is a space for the air to flow. Well, that space is kind of dictated by how the upper jaw grew. The upper jaw is from the eyes to the teeth here. So if our upper jaw grows really well, we get a nice chamber for the air to go in. But if the upper jaw didn't grow wide and big, then that inside chamber in here is tinier. So we struggle to breathe through our nose. That's one problem. The next problem is, well, if the upper and lower jaws are too small, there's less room for your tongue. And when there's less room for the tongue, when we close our mouth, it could only go backwards, because the teeth are at the front and the sides. It's got, our teeth are like a cage. And if we close our mouth, the tongue has only one escape, backwards. So small jaws, crowded teeth, mean the tongue is kind of sitting back, but that blocks the air from getting by. So adults, myofunctional therapy, nasal hygiene techniques, sleep studies are a good idea to make sure you don't have OSA. If you could rule that out, great. If you do, you definitely want to pursue treatment. And then, of course, the ENT is a nice visit, because they should take a look in there and see, maybe you have a deviated septum. Maybe you have extra things in there that are a little bit in the way, and they might help reduce some of the tissue to give you a head start. So there's a lot to look at and do to pursue in an adult. And yes, there are categories that exist where you can help yourself. It's not too late.
That is very encouraging news, that it's not too late. And I'm curious, with expanding the jawline, does that change a person's appearance at all?
Oh, it will deliver a more broad or wider smile. And so it's usually an aesthetic improvement, because the adult who's narrow or has crowded teeth, when they smile nice and wide, there's what we call an empty corridor, almost like a shadow between the corner of the lip and the teeth. And so that is not a full smile. It's really just displaying the front teeth, and then the teeth go straight back because we're narrow. If we were to do some expansion techniques, the teeth kind of fill in the smile line. And next thing you know, you just see teeth when you smile, not a little empty corridor on the sides, like no dark shadow on the sides in a smile. That would be good, well-developed width.
Very
so interesting. You can improve your smile line, is what we were saying. Not so much change your face. You're going to look the same. You're going to look similar, but you're going to have a more broad, wide smile. It's an appealing change.
Oh, very interesting. Because that would, if it were going to change a person's appearance, that would definitely deter a number of people, I would imagine.
Yes, and we wouldn't want to go in a direction where it's not an appealing change. So the good news is, when you are crowded front teeth, you're kind of narrow. So we are looking to be wider, and heading in the wider direction or expansion is kind of going where you belong. So anytime you're heading where you belong, you should be looking better as opposed to the other way, which, yeah.
Gotcha. So in these 2 decades of your study, basically, of improving the foundation and the jawline, and now impacting nasal breathing, what have you found to be the cause of, if you found any, to be the
Yeah.
cause of this change in the narrowing of our jawline in modern times?
So it turns out when you start to dig and take the classes, you do stumble upon anthropology research. And so I didn't create any of it or invent any of it, but I was very happy to learn it. And it turns out we have hundreds of years of anthropology research that teach us what is really the cause of underdeveloped jaws.
Mm-hmm.
Smaller jaws, crowded teeth, bad bite. So in dentistry, we have our professional word malocclusion, bad bite. So it turns out there is a cause of malocclusion. Having crowded teeth or a bad bite has a cause. But again, the teeth are the symptom, the foundation is smaller. And here it is. You ready for this? I didn't know this a while back. And then when I stumbled upon it, you become like a student. You want to read more and learn more. Well, anthropologists who study cultures and change over time, they recognize that the pre-industrial, pre-Western living cultures who are living naturally, they transition from breastfeeding to hard food in the infant. So that 6 to 9 month old window is where the hard food starts to get grabbed by the infant and gnawed on. Well, in cultures like that, the meat product is cured because there's no refrigeration or any type of preservatives. It's basically, if they have meat, it's cured with salt, and that basically is preserved for them to gnaw on. Well, that's like what we would call jerky. It's very tough. So the food products in the pre-industrial, pre-Western living cultures, whether it comes from the land or the sea or the air, or it could be whatever it might be, it's going to be a little tougher. So the consistency of that diet is tougher. Whereas with industrialization and Westernization, there's a transition to early soft food like mush. And mush is only really existing in the industrial Western living model, where we have purees, or we go get the food and we blend it to a puree. Mm-hmm. And next thing you know, we're spoon feeding a mush for a lot of those early months. Now, what we learn about jaw growth and development is that the majority of the jaw growth and development takes place from 0 to 4 years old. And so from 0 to 2, it's about, more than 50%. Then from 2 to 4, there's another 10 or 15%. So we're really moving along pretty rapidly, then smaller percentages. So the anthropologists recognize that in the early years, having softer food meant the muscles, the tongue and the lips, cheeks, the face muscles would be weaker. Softer food, weaker muscles. You don't have to work as hard. With the weaker muscles, it doesn't produce the jawbone growth. And so it turns out the bone yields to the muscle. And our jawbones don't only grow by genetic pre-programming of size. They grow by the amount of muscle activity that's happening during the early years. So basically, the short answer for why are the jaws so small and the teeth so crowded in like every kid you meet, and they all need braces and they all need their wisdom teeth out today, kind of thing, right? I know I'm exaggerating with all, there's a few that don't, but most children need braces and or can't fit their wisdom teeth. It's because of the early soft diet. The early soft diet is the trigger. What that does is it makes the muscles weaker and dysfunctional. And so when the tongue, lips, and cheeks, when all of the muscles of the oral cavity are weaker and dysfunctional, we don't get the jawbone growth. So we get smaller jawbones, crowded teeth, bad bites. So early soft food is what starts this off. And it's a self-inflicted wound.
Yeah.
This becomes. Who knew?
Right. So what would you suggest to the parents who are listening, who might have very young kids, or maybe a mama who's pregnant and what might you suggest for a oral development perspective to do when it comes to feeding their kids?
Yes, I would recommend sources to learn more. In other words, it's not for me to say what to feed your child. I'm not an expert, but I do know there are experts out there. And is it okay to mention a couple of names? I have no financial relationship with them whatsoever. One of them happens to be a book, but it's also an Instagram following of baby-led weaning. Mm-hmm. And Baby-Led Weaning by Jill Rapley and Tracy Marquette. It's a wonderful book. And weaning is weaning for those listening, weaning, like weaning off of the breastfeeding. Baby-led weaning is a wonderful book, and it's basically how to introduce your infant and toddler to harder foods, to solid foods. The other one is called Solid Starts. And Solid Starts, another one. And when you go to Instagram and you start following them, they basically have the instruction manuals on what can a child handle at certain ages and how do you feed them differently so that they are feeding themselves. So, leading the charge into it, but also not in the mush category, and really teaching you how you could feed your child. Because in a perfect world, everyone would feed their child back to what the natural human pathway was. In the natural human pathway, we don't have crowded teeth because the cultures, what the anthropology teaches is the cultures who have the transition to the harder foods, they don't have malocclusion. They don't have bad teeth and bad bites. Their jaws grow so well that mostly they have 32 teeth right where they belong. So it's very rare to find someone with crowded teeth way back when. Whereas today it's super common because we're generations into this. So baby-led weaning is a wonderful resource, and Solid Starts, wonderful resource. And then after that, when you start to Google and search, and I know it's terrible to leave out others because there are a dozen of these, there's more, and I love them all. So when you start to follow one, then follow another and another, and the more you learn, the better. But it is changing the diet early would be like really the best thing you could possibly do. But I don't meet the children in my office till they're 3. So we could talk about that maybe next. What do you do when they're 3 or 4 and they come in and we've already missed the window in the early days of the food,
Yes, perfect segue, because that was going to be my next question is at what age do you start working with these kiddos to help them develop the proper oral cavity to set them up for health and wellness far into their lives?
Yeah, so we do meet the children at 3. In my office, I start at 3. And I know there are practitioners who start at 1 and 2. I mean, there are practitioners who begin even earlier. I just happened to find my niche where 3 to 12 worked really well for me. So I can begin at 3. And I know I have colleagues who can even start earlier. But from 3 to 12, when a child comes in at 3, they've got their baby teeth. Mm-hmm. And one of the things we would know right away at 3 is there's no space between them. That's very common. Mm-hmm. When we look at the baby teeth and we don't see space, we know the permanent teeth are going to be very crowded. So we already know the jaws are undersized, and no one outgrows this. That malocclusion, that bad bite, this underdeveloped jaw condition, it's not something that spontaneously corrects. There's no correction over time. So we don't get to look at a 3 or 4-year-old and say, oh, you don't have spaces in your baby teeth, but maybe you'll grow into the new teeth later. That doesn't happen that way. So they get progressively worse and the crowding's coming. Well, we think about taking good records. So we're first of all, make measurements, look at the teeth, there's no space. But then we start asking the questions. Now that we're into this quite a while, we do start asking about how's the sleeping? How's the breathing? Do you notice your child breathing through their mouth during the day or at night? We ask parents to do observations. Does your child have nightmares? Have you had a history of ear infections? Or does your child grind their teeth? Is your child wetting the bed? Is your child waking up at night and coming in your room? Or you have to get up and then put the child back to bed? So there's a long list of symptoms that are related to poor breathing and poor sleeping. And when we start to ask questions and learn, oh, the parent is struggling with a list of symptoms. And maybe part of it is the behavior. There could be hyperactivity. There could be some fatigue. There could be, a mixture of these things. Tantrums are part of the list. And sure enough, when you get these lists of, oh no, we've got some symptoms and we can see there's no space in the teeth. Well, remember, if the teeth and the baby teeth don't have spacing, the jaws are too small. If the jaws are too small, we can't breathe as well. Mm-hmm. The child might already be mouth breathing quite a bit. And mouth breathing is a pathway to becoming very unhealthy. And so there's a huge difference between nose and mouth breathing. And what we recognize, we talk to the parent about the symptoms, we show them what we see in the mouth and we tell them, look, we know you're 3 or 4, but if we wait and do nothing, the child gets progressively worse over time. The symptoms will get worse and the teeth will come in crowded, and fixing the teeth later doesn't solve any of these problems. So we teach them about jaw growth and development early. And how do we do that? Well, what we want to do is the opposite of how we got here. So if we got here by, hey, our muscles were weak and dysfunctional. If our muscles weren't doing the right thing, well, all we need to do is get our muscles back. So we combine a few things. And at this age, we have the myofunctional therapy is a wonderful opportunity to redirect the breathing and the musculature. So we work with myofunctional therapists. The second item, there happen to be what we call guidance appliances. And guidance appliances, if you held one in your hand, you would look at it and say, oh, it looks like a football mouthguard. It looks like something you'd pop in and run around and play football in. And that's not a bad, kind of take on it when you first see it. But meanwhile, these guides that we can give children between the ages of 3 and 12, when they wear it for 1 hour a day, plus to bed, When the guide is in, it kind of redirects the muscles to behave properly. So the guide redirects the tongue to go to the roof of the mouth, which is where it belongs. And it also directs the tongue to swallow properly because the way the guide is formed on the inside, the tongue can only swallow correctly. And it turns out there is a difference between swallowing correctly and swallowing incorrectly. If we swallow correctly and our tongue is resting appropriately, we get better growth of the jaws. But if we're swallowing incorrectly, well, the incorrect swallow leads the lips and cheeks to start to compensate and help us swallow. So the tongue that's been eating soft food all those early years stays lower and is weak, and it can't really make the swallow by itself. So the child starts to recruit the lips and cheeks to help swallowing. But when the lips and cheeks are working more, it kind of retards the growth forward and wider. So we have the outside working stronger, but the inside weak. We're going to go the wrong way. Now we're collapsing. We got to reverse that. So let's get the tongue in the roof of the mouth and get it swallowing properly. But now when you put your guide in, it also pushes away the lips and cheeks a little bit. There's a little barrier there that kind of pushes away. So when you smile, you see your guide instead of your teeth. It's right in between the two. That takes the lips and cheeks out of the swallowing pattern. So now the tongue's working properly and the outside isn't contributing to the swallow. We start to grow wider and forward. And if we could grow wider and forward, that would improve the breathing. So we basically combine wearing a guidance appliance, myofunctional therapy, and nasal hygiene. Combining these three things can help a child regain the nasal breathing, regain proper jaw growth and development, and slowly over time, the teeth start to migrate where they belong all by themselves because the musculature is guiding them there. So this is what I've been doing in my practice for a couple of decades with children. And then again, the first 10 years, you're picking up pieces, you're doing more and more, the puzzle's getting bigger and you're learning more and more. And then of course it became about, this is really whole body wellness, because the moment that child starts to breathe more through their nose and sleep better, they start to heal, and symptoms that are considered like medical symptoms start to fade away. And so the most interesting thing is I'm just a dentist. So I don't treat behavior. I don't treat bedwetting. I don't treat ear infections. I don't treat digestive issues. I don't treat headaches. I probably said ear infections already. I don't treat waking up in the middle of the night. There are things that are a list of symptoms that I certainly don't treat those. My diagnosis is in the oral cavity. It's underdeveloped jaws or malocclusion. I'm treating an underlying problem. And when that improves, it happens to improve the breathing, which improves the sleeping, which allows that child to heal. So I see resolution of symptoms downstream, but it's good for your audience to know I do not treat the list of things that are so-called symptoms, because it's not, appropriate for me to say that, but I treat the jaws and then good things happen to the child, basically.
You are just doing my job for me, because I was going to ask if any behavioral symptoms get resolved by these treatments that you provide to the kiddos. And you've kind of touched on it. And I know we want to make it clear that you are not, you're not an MD, you're not treating, or a psychiatrist or whatever. You're not treating like ADHD type conditions.
Absolutely.
But I'm hearing you say that you're seeing these types of behaviors improve with the improvement in their jaw.
Yes. And so I would say absolutely. To be clear, I do not treat ADHD or behavioral issues, but I can tell you over 20 years, I can share my experience because I'm treating the jaw growth and development. And then over time, you start learning that there is a correlation between poor breathing while sleeping and behavior the next day. And I can give that researcher's name. It's Dr. Karen Bonnick. So Dr. Karen Bonnick, Bonnuck, I would encourage parents to go right to YouTube. And when you YouTube Dr. Karen Bonnick and sleep disorder breathing children, you can see videos of her being interviewed. And she describes her research. And what she set out to learn was, is there a correlation between behavior during the day and how a child might be sleeping and breathing, snoring or apnea, things like this? And it turns out what she learned over time, and she studied, I think, 11,000 children over about 6 years, a very big study. She learned that there was a connection between the behavior and the poor breathing at night. She also incidentally learned, because they were IQ testing the children along the way, that there was also a correlation between a child's IQ. And so cognitive impairment or cognitive development was also related. Turns out nose breathing children tend to have a higher IQ than mouth breathing children while they're sleeping. So mouth breathing or snoring or apnea, these are all bad breathing techniques, right? Of course, We'll call it, generally we'll say mouth breathing, we'll call it mild. We'll say snoring maybe is moderate and apnea is severe, just to give a range, because breathing can come in ranges. It's not like mouth breathing is the worst you could do, but apnea being worse, mouth breathing is bad, apnea is worse, kind of a perspective. She learned that mouth breathing children or worse, mouth breathing, snoring, apnea kids, they tended to have lower IQs than the kids who were nose breathing at night, but they also had worse behavior. So then the mouth breathing is related to the behavior. Now, I don't treat the behavior. We diagnose at the jaws, and what that means is, hey, we recognize the jaws are too small, your teeth are crowded. That means there's less room for the air to flow through your nose because your upper jaw makes the nose. And your tongue has no room because your jaws are too small, and that's further back. So we could see the connections of the anatomy to the airspace that we have to breathe. If we grow the jaws, we improve the breathing. If we improve the breathing and a child transitions from mouth breathing to nose breathing day and night, we do see the behavior improve. And it has become so routine for us that we now expect it to improve. At the beginning, we didn't know, is this going to be happening for 1 out of 10 kids, 2 out of 10 kids, where a parent will tell us my child behaves better now, or they're performing better in school. Now here we are, 10 years after learning this was related. It's to the point where we kind of expect to have those improvements. Now, we don't promise anything. We're trying to help the child, and we're excited when they do improve. But yes, my experience has been that children who come in who have been recommended to be evaluated for such behavioral conditions, if we treat them first, those symptoms fade away and they no longer need evaluations or treatment. Kids who come in who have already received evaluations and maybe even have some treatment in the symptom category, like medications, if we treat the jaws and they grow and they sleep and breathe better, when they start to heal, they can reduce and then eliminate the medication. That, of course, gets done with the doctor's office. We don't do that. We would never say, oh, you feel like you sleep better, take your medication away. No. So we have to talk to the physician and say, look, we've been doing this. We are breathing better, sleeping better. When the parent has a conversation, they can start to wean, because you don't stop those cold turkey. You have to kind of wean your way off medication. So my experience now is that, yes, it's most of our patients that we treat have improvements in their behavior enough to avoid medication or come off of it. And we're very happy about that, because, long term that doesn't really solve the problem. It's treating the symptoms. So we enjoy helping patients off of medications. We're a big fan of that.
Absolutely. My next question is something that I have to remind myself all the time, being a big proponent of keeping a healthy gut flora. I often have to remind myself, I call them gut bugs. I have to remind myself that our gut bugs begin in our mouth. And so have you read any studies, or do you happen to know any correlation of the good gut bugs with mouth breathing versus nasal breathing?
Yes, these are related. And so it does begin at the mouth. And so obviously, the digestive system is right from the lips all the way through. So it turns out that the oral bacteria, which we have a lot of, and then of course the majority are the good ones that are working with us all the time. And then there's a small population of the bad ones. And if they get the advantage, they can wreak havoc. So we'll start at the oral cavity. Well, one quick way to change the balance of the oral microbiome, the bacteria in the mouth, would be to change from nose breathing to mouth breathing. So the nose breather has the mouth closed and sealed, and the air goes behind and in and out, never really passes through the mouth. But the mouth breathing child has a number of problems happening. Number one, the airflow right through the mouth is providing a level of oxygen and carbon dioxide passing through, and other ingredients, but all of it's passing right through the mouth. So the bugs in our mouth have opportunity to enjoy those things. But then, of course, the mouth breathing dries all the saliva out. So the drier the mouth is, the more unprotected it is. So when you combine, we're providing different ingredients to the mouth bacteria that normally shouldn't be passing through there. Then we're going to dry all the saliva out, which is our protective shield in there. All of a sudden, the bad bugs get an advantage. So now the oral microbiome changes. And one of the more instant things you see in the mouth, and again, part of the digestive system, the change in the bugs delivers a lot of cavities. So it turns out cavities are the result of mouth breathing. And mouth breathing is really the primary driver of decay in children. So when we think about cavities, most people know, if I eat a lot of sugar, I'll probably have more cavities. Sure, that's a fair statement. If you want to eat a lot of sugar, you might have more risk for cavities. Another fair statement would be, if I don't brush my teeth, I'll probably get more cavities. Yes, if you don't want to have oral hygiene, you'll probably get a little bit more cavities. Now combine those two. I'm going to eat a lot of sugar and I'm not going to brush my teeth. You're probably going to get a lot of cavities, right? And all of this is kind of the common knowledge. But the missing piece is that most people don't understand that we primarily get cavities because of the mouth breathing. And so it's amazing how many parents today have their children on a very strict and nutritious diet. No sugar. Have dental hygiene. We brush, we floss, and those kids get rampant cavities because they're mouth breathing. So you don't need sugar and you don't need poor hygiene to make cavities. You just need mouth breathing. Mouth breathing alone can make decay. Now, the three of them can work together, of course. If you have a child who's going to brush their teeth in that 10 seconds, not so good on the hygiene. Sweets and treats and carbs, they're part of our diet. It's very difficult to have no sugar, zero, right? So that's difficult. So we know we've got a little sweet in there. We know we got a little bit of maybe the dental hygiene isn't 30 seconds and flossing. So, but if we're mouth breathing, we're going to get the decay. Now, the nose breather, turns out the other way, the nose breathing child can actually have a little more cushion with the sugar and the hygiene. So if you're breathing through your nose really well, you're not as prone to decay because you don't have really the ingredients that are needed to make that decay. You haven't changed the bugs very much and you haven't taken away the protection, the saliva. So now the digestive tract, the mouth breather, it does affect how we sleep. And so that's where the whole digestive system comes into play. So we have these two systems in our body, and one of them is, and these, of course, there are professional words, but then there are the words people recognize. So I'll just throw both out there. Don't know who the audience is completely, but we have our nervous system has two parts. There's a parasympathetic nervous system and a sympathetic nervous system. So most people know about the sympathetic nervous system as fight or flight. So we got this fight or flight system. It's very protective. It helps us a lot. Well, the other one, the parasympathetic nervous system, that's loosely called rest and digest. Well, it turns out when we lay down to go to sleep, we're supposed to fade into that parasympathetic nervous system where the resting and digesting is going on. And that works really nice. It's a beautiful system where the brain is going to clean itself, clean the body. The digestive system is going to work nicely, moving things along at night while we're resting and digesting. Well, it turns out that really only happens beautifully if we're nose breathing while we're sleeping. Nose breathing at night keeps the parasympathetic nervous system running well. So it's kind of like almost like a fuel for that system to run well. But guess what happens when we start mouth breathing? Mouth breathing is so bad that your brain knows that's not good. I have to fix it. So what the brain does is it turns off the one function to focus on the other. So now your brain cannot do rest and digest, parasympathetic activity. Resting and digesting can't happen if we're breathing poorly, because your brain will shut off the resting and digesting and the cleaning functions, start to work on the breathing and try to help you breathe better. And the brain switching functions means it turns on fight or flight. Helping someone to breathe better at night means we activate the sympathetic nervous system. We're in fight or flight. And when we go to sympathetic drive or have fight or flight active, it shuts off the digestive system. And next thing you know, when your digestive system is not functioning at nighttime, it leads to complications downstream. So you could talk about anything from stomach aches to reflux to constipation to diarrhea. The imbalance in the digestive system begins at the mouth, works its way through, and all of this works towards changing the gut microbiome. Yes, nutrition, absolutely nutrition. What you eat is part of the fueling of a human being. So what foods are we eating? That can affect the gut biome. And then, of course, the breathing is part of the puzzle. How are we breathing? That affects the gut microbiome. And part of it becomes the mouth breather and the swallowing that I mentioned way back when. I missed that one step in there. Back up. So the mouth breathing human being has to have a low tongue posture to let the air go in and out. So what the mouth breather with their low tongue posture and using their lips and cheeks to swallow, when the swallowing pattern is off from this muscle dysfunction, what happens is we swallow more air. So a really good proper swallow is tongue compressed to the vault. It does a wave back, but it's a sealed environment. And it's like a vacuum swallow. So a vacuum swallow, no air is going in there. But when we have a poor swallow and the tongue stays low, that's a lot of air in there. And we start to actually swallow air. And swallowing air will eventually work its way down and fill the belly. And when the belly gets full, a little too full, it has to release some air. So releasing it one way, of course, flatulence, and releasing it coming back up when the belly gets a little too big. If it can't hold it enough, it'll come a little bit coming up. It brings the acid too. So for a lot of infants, children, teens, adults, for a lot of people at different ages, reflux is partly due to swallowing too much air. not necessarily the spicy wings. So swallowing too much air is introducing air into the digestive system, but some of it's going to go all the way through. But now we're swallowing air repeatedly with these poor functioning tongue muscles, and that air keeps passing through the system, and next thing you know, it's going to have an effect on the microbiome. So yeah, almost anything can affect the microbiome. The top three list would be, of course, the nutrition, how we're breathing, how our muscles are functioning, and then last but not least, the activation of fight or flight when we're sleeping, when we're supposed to be getting the digestion process running well, we're actually in fight or flight instead. So it's a lot bigger picture. I know we're limited on time, and I'm sorry I'm babbling, but it's a big puzzle.
It is a big puzzle, and I feel like this is such a passion of mine, particularly nutrition. And like you were talking about the parasympathetic and the sympathetic nervous system. And I feel like there's nothing left for me to learn, yet you have taught me so much about all of this, especially the swallowing of air. I am evaluating myself right now, and I definitely am not, I don't swallow properly. I do swallow too much air, and I've always been kind of a belchy type person, and I've now I know why. And so it's time for me to go get evaluated.
Yes, you would benefit from myofunctional therapy as a starting point.
Yeah.
That's a wonderful place to be. They're going to help correct all this stuff, and then you can be evaluated in other directions too. But yeah, so with the kids, it's while we can help adults, it is a little bit more important in the child, because we could then prevent a lot of things, because the symptoms that you have as a child slowly get worse over time, because that repeated long-term poor breathing and poor sleeping takes a toll on a human being.
Yeah.
And there is a difference. I like to talk to my patients about aging versus deteriorating.
Mm-hmm.
And yeah, there's a big difference. And they start to recognize, oh, the light bulb goes off, because we're all aging. Nobody likes it. I get it. Nobody likes it. Nobody wants to age. And I totally understand it. I don't want any part of it either. But we're all aging. Now, aging is one thing, but what if I'm not aging? What if I'm deteriorating? That's a different category. And mouth breathing alone is a pathway to be deteriorating over time instead of aging over time. And it turns out a human being who nose breathes beautifully, if you had like all of those wellness choices you're making day and night are going well for you, and you have good jaw growth and you have good breathing, you're going to be healthier longer. So you can have a really nice health span, because there's lifespan and there's health span. I'm going to live a certain length, but am I going to be healthy the whole time, or am I going to struggle for a period of time? So we're trying not to have the kids develop into these chronic illnesses that they battle symptoms for the rest of their life related to their breathing and sleeping and how bad the sleeping is.
Absolutely. Oh, like I said, Ben, this was just so enlightening for me. I'm excited about how much I learned and how much more I have to learn in this space. But we are going to start to wrap up. So I have a few questions left, and I want to ask if you could text one tip to everyone on the planet on how to be well, what would it be?
Nose breathing. I would say do everything in your power to be the obligate nose breather that human beings were meant to be. Work for nasal breathing. Nasal breathing is probably, in my world, the single most important thing you could do. And it's not the only. I know there's a list of 10 things we have on there, but nasal breathing would be number one for me.
Awesome. What's your favorite book?
Oh, well, the breath is very nice, James Nestor. That's more recent, but I would tell you before that book, it probably is my favorite book right now, is by Dr. Robert Corcini, but it's not a book for people to read. It's an anthropology research book. So it's but I'm kind of a stalker of his, in that I couldn't learn enough from this gentleman, and I followed him everywhere he went so I could learn more from him. But Dr. Robert Corcini wrote a book, How Anthropology Informs the Orthodontic Diagnosis of Malocclusion's Causes. And that title should do it. Everybody should be asleep by now. So I'm going to say you're welcome to all of you who I just put to bed. Have a wonderful nap. But it's basically the textbook that wraps up his 40 years of research. Wow. So technically it's a textbook. But that's where I learned the most about the anthropology research, the historical human pathway of being healthy and growing their jaws, and how the early soft food triggers this pathway. That book has been probably one of the biggest drivers of how I approach my patients, how I'm looking to treat them, what I'm looking to do for them, resolve and go. So that's probably the most impactful book in my history. It's just not for reading. It's more for research.
Yes, I doubt anybody listening to this, unless they are a dentist or an oral facial myo
Right.
functional.
Oral facial myofunctional therapist.
There
You've
we
got
go.
it.
I knew I
Yeah.
was going to get all the pieces. Um,
Yeah.
but that I will reiterate that Breath book by James Nestor
Yeah.
is
It's a
he
great
tells
book.
he tells a great story with it. He puts in all the research, him in the catacombs in France looking at all these skulls. I mean, that's
Yeah.
just freaky. So
It's impressive. That book is impressive. Yeah. Very helpful. Anybody can read that and learn. It's a great book.
absolutely. All right, Ben, I have 4 quick questions during
Okay.
a little lightning round that I like to ask everyone. So are you ready?
Yes.
Okay. First thing that comes to your mind, what's your favorite food?
Oh, pizza.
Popular option.
I would
What's
say
your
pizza.
favorite exercise?
Push-ups.
Oh, very simple. Anyone can do it anytime, anywhere.
Mhm.
What inspires you?
Oh, helping kids.
Awesome.
Yeah, the difference in the child makes it you want to go back and help every kid you can meet because you see the struggles. So helping a child helps me.
Awesome. And then what is your biggest indulgence or guilty pleasure?
Anything chocolate. So chocolate.
Another popular option.
Yep.
All right, Ben, I have thoroughly enjoyed this. This was, like I said, I have learned so much from you. This is great. I know I'm so fortunate that I'm in a region. I actually have patients who take their kiddos to oral, facial, myofunctional therapists. And
Yeah.
so I know out here in Southern California, we have access to this, but that's so encouraging that for people who are more remote or it's just not available out in their area, that people who
Yes.
do what you do can do this online. This is amazing. That's so exciting.
Excellent. Would you mind if I mentioned a website
Absolutely. I was going
for
to ask
people to look into?
how people can get in touch with you, and so any resources
Yeah.
you have would be fantastic.
Yes, there's always more to learn. And so we did build a website for parent education, and it's kind of cutely, affectionately called toothpillow.com. So Toothpillow, just the way it sounds, toothpillow.com. And when parents go there, that website has a lot of the things we've talked about built out even more thoroughly. The connections and all of it there for them to see and learn about. And there is part of that website where is my child a candidate for early treatment? Can my child be helped in an early fashion? And when they click on that tab, they can enter a little bit of information, and I screen the children. And we built a pathway to provide for access. We solved for access because there are so few of me floating around doing this early treatment that a team of us kind of founded Toothpillow to basically solve for access and affordability. So any parent anywhere could learn about this and decide, I would like to pursue early treatment for my child in this technique. And if they go to toothpillow.com, you can learn if your child is a good candidate for this early treatment, and we're here to help you, and we can do it remotely.
Fantastic. Ben, that was so great. I will link up toothpillow.com in the show notes so anybody can find that there. And is there anything else you wanted to leave the audience with today?
One thing I would encourage the parents out there that do bring their children to be seen for symptoms. I know that a lot of them are told it's normal, you'll outgrow it, it's nothing to worry about. I would encourage you to keep looking, because you're just hearing from someone who doesn't know how to help your child, but you are right, your child needs help now. So for the parents who feel maybe either discredited or pushed down or pushed away by hearing the words, and I get a lot of this from the parents telling me, I was told that's normal, I was told they'll outgrow it, I was told not to worry about that, you're looking too closely, don't worry. That's all people saying is, we don't know how to help your child now, we don't have options for you, we don't know what to do. And so they are trying to kind of move you along, but it doesn't mean you stop. So I would say, yeah, please keep looking. Another opinion. If you reach out to Toothpillow, we'll help you find people who can help you because they're out there. You're out there. There's many people out there to help your child early. And yes, the bottom line is you are right. Your child needs help now. They don't need to wait, and they won't outgrow it.
Awesome. Great advice. And it just comes back to being a great advocate for your kiddo, which most parents, that's all they want is to be a great advocate. So thank you, Ben, so much. And we'll chat soon.
Absolutely. It was my pleasure. Thank you.
Whether it's improving your internal, physical, or mental health, we have more tools to explore the infinite possibilities within wellness. Be sure to visit us at EmpireWellnessCenter.com for more ways to connect with Charlene. There you'll find ways to educate, improve, empower, inspire, and grow. That's all available on EmpireWellnessCenter.com.